Hi, my name is Beth Pasick and I'm a cat behavior consultant. I've been cat sitting for the past 10 years in and around the greater Cleveland area. I am a member of the International Association of Animal Behavior Consultants in their cat division. I am also a member of the International Association of Animal Hospice Care Providers. So that gives me a large scope and a large basis for talking about cat behavior and what is best for our kitties. Today, this topic is everything about cat behavior many times comes in a box, and that box happens to be the litter box. So this little brief webinar is going to cover the very basics of some of the things that you'll want to look for when you think you may have an impending or ongoing cat behavior issue regarding the litter box. Oftentimes, as a cat sitter, I would see things going on in the litter box that the owners oftentimes dismissed out of hand because it had been going on for quite some time, never realizing that their cat actually has an ongoing issue that needs to be recognized with their veterinarian, or that there is an issue going on in the household that they may not recognize. Things like the size of the urine clumps, if they're using clay litters or crystal litters or paper nuggets or whatever kind of litter they're using may be part of the issue. Things we want to look for in the shape when it comes to cats' feces or poop is the shape, consistency, color, and frequency, and the smell. Just exactly how stinky is it? Other things we want to watch for when we scoop a litter box is the amount of urine and if there is blood in the urine, and is the litter you're using, are you able to even recognize if there is blood in the urine or the stool? These are all very important factors when it comes to behavior modification for your cat who is no longer using a litter box or maybe on the verge of abandoning their litter box, because some of these items indicate not only a preference or a behavior issue, but they may actually indicate an actual medical condition. Urine clumps. The first thing we want to look at is the size of the urine clumps. Are they larger than a $half size? If so, that may indicate several medical conditions that could be happening. These could very well be indications of diabetes, a thyroid issue, or a kidney issue. We want to look at the number of clumps. A whole lot of little clumps in the box where your cat is trying to pee or feeling the need to urinate and can't. This could indicate a blockage, struvite or oxalate crystals stuck in their bladder or urethra. These are medical issues that are quite painful and oftentimes will lead to your cat leaving the litter box. Does your cat pee or urinate over the edge of the box? Oftentimes, I find what is going on is the cat is overweight and the box is literally just simply too small for the cat. And there are ways to deal with that issue. First, by increasing the size of the box and also by increasing the height of the edges of the box. We can pretty much eliminate that issue. If your cat is completely not in the box, that is where we need to truly explore whether it is a medical issue, like the pain issue we discussed in the previous slide, or if there is something else going on. In a multi-cat household, it is not unusual for another cat to actually be guarding litter boxes and actually forcing another cat to choose to not use the box and urinate or eliminate somewhere else in the house. Oh my gosh, yes, we're going to talk about feces. We're going to talk about poop. Shape and consistency. Most cat poo is shaped like a log or a little nugget. A healthy stool is firm, but not too solid, somewhere around the consistency of Play-Doh. Color. Cat poo usually tends to be dark brown. Any other color than dark brown, black, green, red, or light brown should be discussed with your vet. Take a sample into your vet. Oftentimes, if your cat's stool is black, that's an indication that there is blood in their stool that's coming from further up in the system and should probably be investigated by your vet. Some of the other colors could certainly happen if your cat is pooping outside the box, and those colors often indicate that there is an issue, medical issue, rather than a behavioral issue. Frequency. Most cats will poop once to twice a day. If your cat poops every other day, that's probably okay, but you should be looking for them to be pooping once or twice a day. If they're not in some sort of regular rhythm for elimination, they may be constipated. This can also lead to them peeing outside the box and pooping outside the box, because by the time that their bodies are ready to go poop, finally, that they have enough fluid in their system to pass the bowel, it will be at a point where they don't have time to get to a litter box. The other thing with poop is to definitely watch. If your cat has really bad smelling stool, the kind of poop that makes you leave the room, you might talk to your veterinarian about that as well. That could very well indicate that your cat may have some parasites that need to be dealt with, and that's a very easy fix. Blood. Oh my goodness. I love this cat's face. The blood in the urine. The color of the blood, if it's red, bright red, that means it's happening in the bladder. It's fresh. It's usually a urinary tract infection or crystals in the urine. If it's kind of a dark brownish color, it might be happening further up in the kidneys. And again, that is something, if your litter cannot let you see the actual color, that could be an issue. We want to look at the size of the clumps. Oh my gosh, I cannot stress that enough. The size of the clumps matter. Feces, you might see an occasional bright red streak in your cat's feces. This could be coming from a hemorrhoid. It could also be coming from their anal glands. Um, in those cases, you just sort of want to monitor if it is a large amount of blood in their feces. Of course, that will warrant an immediate vet trip. If it is a consistent splotch of blood in their feces, again, that is a trip to the vet. As we know, occasional red or bloody stools can be a scary sight for you. Don't panic if you find blood. There are some normal reasons why that could be happening, but it's worth a call to the vet to see if they recommend to come in for testing or for a check. How all of these factors affect behavior. Um, it affects behavior in many ways, and we cannot deal with the behavior if there are ongoing medical issues with the litter box. We have to deal with that. As you can see from the little wordgram on the screen, there's a lot of things that are going on when we start dealing with litter box problems, because we can often deal with the medical issue, but then there is an ongoing behavior problem where we have to convince the cat that they are not going to be hurt by going into the litter box because they had a urinary tract infection that was painful. So that's where working together as a team helps. Oftentimes, as a cat sitter, I would have calls from my clients because the first person they called was not their vet. It was the cat sitter with a lot of knowledge that their cat is not using the litter box. They will often determine the cat is mad at them and that maybe it's stress related from the vacation. They'll call someone like me or their cat sitter, and they'll want to talk to a behavior consultant right away. Our inclination at that point, if your cat was stressed by the vacation or your leaving or your absence, oftentimes, like people who are under a lot of anxiety or stress, it will manifest as a medical condition that was going undiagnosed. So, the first place, instead of calling us, or you do call us, our first inclination is go see the vet. Let's make sure that there isn't a stress related illness going on versus just a stress related behavior issue. There is a fine line between these two, but we cannot treat a behavior issue if your cat is actually medically sick. And 9 times out of 10, what comes back is your cat does indeed have a urinary tract infection. Once that's treated or the treatment has started, then we can go in and deal with the behavior. And oftentimes that is something that needs to happen. There is a behavior component, and we can step in and help straighten things out. Working together with you, your veterinarian, and us as your behavior support, we can help you bring you back to a happy home and getting along with your feline in a home that is very comfortable, happy, and secure. Again, it will take your input. It takes the elimination of medical issues, and then we can deal with the behavioral aspects of getting your cat back in the litter box. It really is a team effort. It is about you being aware of the issues your cat is going through. It is talking to your veterinarian about all the issues that are happening and all the details that are going on. And once we have all that information, then we can finally start working with the behavior issues. That's our little mini webinar for today. Finicky cat sitting and behavior, helping you keep you and your cat in a beautiful and wonderful home. Thank you for watching.